Right. Good morning, everyone. Last week we changed our public health orders to allow some businesses to reopen. And although some small businesses are reopening, we're not back to normal. And this takes some getting used to, but it's worth it. Because the people of St. Louis County have followed the rules, we've been able to get through some very difficult times over the past few months. To keep them safe, some of us haven't been able to hug our parents or grandparents for months. We're worried about our loved ones in nursing homes, our friends who have been hospitalized, our neighbors who are sick, and sadly, almost 400 of our residents in St. Louis County have passed away. I remain confident that the overwhelming number of residents in St. Louis County are following the rules. The pictures that emerged from Lake the Ozarks over the weekend were an international example of bad behavior. That's why I've asked anyone who was in a large crowd over the weekend, unable or unwilling to social distance, to self-quarantine for the next 2 weeks to prevent bringing COVID-19 back into our community and having it spread like wildfire. We know that 20 to 50% of individuals who have COVID-19 and can give it to someone else, 20 to 50% are either asymptomatic or pre-symptomatic. And we have to recognize that this is a too common way that COVID-19 spreads in our community, and that's why social distancing is so important. Because we implemented our public health policies proactively, we were able to avoid some of the situations that we saw across the country. In fact, St. Louis County issued its stay-at-home orders earlier than anywhere else in the country, any other state in the country, except for California. And because we collaborated with our business community to have business guidelines that were reasonable, we were able to limit the increase in unemployment much less than could have been expected. The coronavirus was a challenge, but the people of St. Louis stepped up and we were able to get through some very tough times together. Beyond the public health crisis, we understand that COVID-19 has had a devastating impact on our economy. And we have to move forward. We have to get our economy open in a slow and responsible and thoughtful manner. But in order to have a healthy economy, we need healthy workers. That's why our public health response is so important. And that's why, first and foremost, our priority will always be the health and welfare of our residents in St. Louis County. One big component of the public health environment is adequate testing. And we continue to improve our testing resources in St. Louis County in collaboration with our testing partners. The Department of Public Health is now able to test anyone who is symptomatic at their facilities, and other testing partners in the community are doing the same. Symptomatic groups of high-risk individuals in close living quarters throughout the community. We are broadening our testing criteria, and we are improving our access to more tests. We received another 1,000 tests from the state. We are ordering more tests. We are reopening the bid process for more tests in St. Louis County so we can continue to have multiple sources of tests to maintain our supply moving forward. Our goal is to be able to test 30 per 1,000 residents, or about 1,000 tests per day. We know that we are testing at least 500, and we're working with our testing partners to accurately collect all of that information. And our testing results will now be displayed on a dashboard on our stlcorona.com webpage. You will be able to follow the number of tests performed in St. Louis County, the positive results, the negative results, and the positive rate moving forward. We'll be able to follow this trend as it is a very important data point in helping us make decisions in our public health response in St. Louis County. If we do this right, and everyone plays by the rules, we'll be able to get back to a strong and healthy economy. And more importantly, we'll be able to hug our parents and grandparents again. And I'll be glad to answer any questions.
So maybe you talk about people who are at the Lake of the Ozarks self-quarantining, wondering how confident you are that that's actually going to happen and how concerned you are about that not happening, given what you just said.
We're working very hard to get the message out into our community that that was a bad decision. And we want everyone to recognize and understand that and do the right thing moving forward and to learn from it. Certainly anyone who exercised poor judgment in the past can do it again in the future, but we're reinforcing how important that is and hope everyone will again respect our public health orders. That's how we move forward as a community.
Tuesday will be the first municipal election since COVID hit. Obviously, there was the presidential election when COVID was spreading throughout the community, but how confident are you that that election in St. Louis County, which is a major election because there's a lot of races, is going to be safe for people who didn't get an absentee ballot and are deciding to go vote in person?
Well, everyone should wear a mask when they go to the polling places. The polling places have initiated new protective measures. The St. Louis County Board of Election has done a good job with that. They'll be wearing masks, they'll be sanitizing frequently, and they'll be taking all the proper precautions for social distancing and limiting crowds of size. Ideally, voting absentee in a pandemic is the safest measure, but I believe that some of the guidelines, some of the measures that have been implemented by the Board of Election will make the polling places much safer than they could be.
I was talking with both Rick Stream and Eric Fay yesterday, and they mentioned to me that 76,000 people had requested absentees, which is a record going over even presidential elections. I understand that you're not in control of the election board, but it stands to reason that that number is going to go way higher in the primary and the general election. Have you been talking with them about whether they're prepared to handle an even greater influx of absentee ballot applications, especially if the governor signs the bill that will expand the availability of them?
So the question is about whether or not the Board of Election can accommodate an influx of absentee ballots. I believe they can. They told me they will be prepared for that. They're preparing for that. We may have an absentee ballot rate of 40 or 50%. I think it's entirely possible. Moving forward, people are going to get much more comfortable with voting absentee. There's some changes made in the legislature to make it easier for people to vote absentee. Not as easy as it should be, but it was a step forward. And I would encourage people to vote absentee in the upcoming election. It will limit the crowding. June, August, and November. It will limit the crowding at the polling sites, limit the traffic. And there are certainly people who are at higher risk who should be voting absentee for certain.
You mentioned earlier that you all plan on testing about 1,000 people per day with this new broadening of the testing. Right now, you say you're about 500. When do you think you will be able to hit that goal?
Well, we're at least 500.
Okay.
It's hard for us to track everyone who is testing in the community. And we're requiring them to report the test to us. But not only the tests that they do, we want to know who they're testing. Are these asymptomatic people? Are they symptomatic? Following the positive rate among symptomatic and asymptomatic people will be important.
We don't really have a timeline right now as to when you can get to 1,000 or what your thoughts are.
Well, we're over 500 now, we know. And part of the issue is collecting all the testing results from a very diverse group of people who are testing. And we're working with our public health department to collect all that information from the health systems who are testing, from the federally qualified health systems who are doing a lot of testing, from the private labs who are doing a lot of testing, getting that information to us and making sure we know what is, what's an antibody test, what is a test for the presence of the virus, and who they're testing. We'd like to have that information. It's very important for monitoring the spread in our community and understanding its impact.
What's to stop people from doing what happened to Lake Ozarks again, going forward, except is it just an issue of using better judgments or anything else that can be done to head that off?
Well, we expect all of our businesses to follow the social distancing guidelines and the business guidelines in St. Louis County. And if we see people who aren't following those guidelines, we'll have a conversation with them. I think what we saw at Lake the Ozarks was folks who just lost control. And moving forward, I hope they learn from that. We're only in control and responsible for, able to take responsibility for what happens in St. Louis County. We're working very hard to make sure everyone in St. Louis County knows the risk they are taking and knows the risk they are bringing back to their community and to their family members, because we know that COVID-19 spreads among people who are asymptomatic and are pre-symptomatic. And being in these settings in close contact not respecting our social distancing guidelines puts everyone at risk.
Do you have any idea of how many people might have been there who were from St. Louis County? Is there any way to know?
Now, there's no way to know other than Lake of the Ozark remains a very popular weekend destination for people from St. Louis County, and I expect it will always be a popular destination. We know a lot of people that went to the lake, a lot of people who went to the lake and were able to follow social distancing guidelines, and we believe that people can do that and still enjoy their time. Yes?
Last week you talked about that you were meeting with gym owners and things like that. Is there an update with that? I know it's a process, but.
No, I think we've had good communication. They're providing with some of the recommendations, and our Department of Public Health is processing those recommendations. I think it's a productive conversation, and everyone's participating in good faith.
Can you explain, yesterday at the county council meeting, Councilwoman Dunaway talked about one of our committee meetings where there was a discussion with the municipal league about how the money is going to be dispersed to municipalities. Can you just kind of explain what the process is for that? Because I know in like Jackson County, that's been a big issue about Jackson County not being able to get money to Kansas City, and I wanted to hear what the update was for the munis.
So the question is about how do we help our municipalities with their COVID-19 related expenses and what that process will look like. We're trying to get clarification from the U.S. Treasury. We are limited in St. Louis County to spend this, what is essentially a federal grant, a stimulus grant. We have to follow very strict guidelines set up by the Treasury Department. And the initial guidelines were that it could not be used for expenses that were previously budgeted and in a local government budget, previously budgeted for, or were not related to the cost of COVID-19. Could not be used to supplant something in the budget. It could not be used to replace lost revenue. So we're trying to work within those guidelines to get guidance to see how we can help our municipalities with their public safety costs. And once we have that guidance, we'll set up a process for municipalities to request reimbursement, and we'll work with them. If those rules are relaxed by the U.S. Treasury, it will help St. Louis County too, and I hope they are relaxed, and it will help us with some of our public safety costs as well. But we have to get that guidance from the federal government. If we do not follow their guidance, then all of us will be faced with having to repay those funds. So we want to make sure we get it right. And we've set aside the amount of money that the Municipal League identified as they thought might be their cost. So we set aside $47 million and reserved it in our draft budget. So once we get this process worked out, we'll move through it in a very thoughtful way.
When you say public safety costs, is that because sales taxes have gone down and the Proposition P formula distributed to municipalities is just not there, or is it completely separate?
Well, sales tax will go down across the board. All sales taxes, Proposition P is part of that sales tax, but St. Louis County and a lot of our municipalities receive a lot of their budget from sales tax. So when sales tax falls, then they have a revenue shortfall, for sure. Not just Proposition P, but all sales tax.
You mentioned emphasis on testing on high residential areas, I guess, maybe nursing homes or apartments. What's the plan with that? Do we test and then just move on, or do we need periodically tests in order to kind of stay on top of it?
Yeah, so the question is, how are we managing our nursing home population, high-risk populations? There are about 150 nursing homes, congregate living facilities for high-risk individuals in St. Louis County. We have a high-risk task force of volunteers that monitors them on a regular basis, checks in with them to see how they're doing, if they have any concerns. We have a quick response team made of public health officials who go into those facilities if there's a concern or a positive test, and then they test everyone that works there who lives there, and processes those tests. They make sure they have the right PPE, the right training, and help them with a deep clean, and they do all that within 24 hours. So we have a pretty good rapid response team. We're working through our nursing facilities in the county in a very methodical way, but we'd like to get them tested. Any other questions? Okay, thank you.